Hello, everyone. Thank you, OIS, for having me here and being able to present our data. What we're going to talk about today is the LightSight 3B study. This is an open-label, prospective, multi-center extension of the pivotal LightSight 3 study that led to approval of the Valeda light delivery system in November of last year. The Valeda provides a photobiomodulation approach targeting mitochondrial targets within the cell to stimulate metabolic activity and blood flow. And we're going to talk about the extension study that followed the patients for another extended period of time. These are the participating investigators in the United States for the study. And just as a little backdrop, the LightSight 3 study was a pivotal study that is shown on the left here. It was a 2-year study where patients were treated 6 times over the course of 2 years. Each series was 9 treatments over the course of 3 to 5 weeks. Patients were diagnosed with dry AMD that were enrolled with some vision loss, 2032 to 2100. They could not have central involving 1 millimeter of their fovea of geographic atrophy. And those study results will be shown in the next few slides. Unfortunately, we were very lucky to get a small business incentive grant to do an extension study, but there was over a year of delay from the NIH until we could get funding. So there's a 20-month intermission here, which turns out to be a very interesting washout period that we can look at before we start the LightSight 3B extension. All patients that were in the extension study had to complete the LightSight 3 study. We allowed the other eye, whether it was a non-study eye or whether it had moved outside of the early inclusion-exclusion criteria, to participate, and every patient in this study received photobiomodulation for another year, 4 rounds of treatment, and the study was just closed, and these are some of the trial results. So we had 63 eyes from 36 subjects that continued. There were 38 eyes in the PBM group originally treated with PBM, 15 eyes originally treated with sham, and then 10 non-study eyes, and we'll just focus on the PBM and sham original treatment groups. Again, there was about 600 days or 20 months extension or washout period between the trials. And if you recall, and I'll show you in a few slides, LightSight 3B baseline for this was not randomized. They were randomized when they came into the original trial. And so in LightSight 3, they actually gained some vision. They ended up at baseline at this study at 74.6 letters, and LightSight 3B sham group at baseline was at 65. So there was a clear difference between their starting BCVA, and we'll talk about that in the next few slides. Obviously, patients were predominantly Caucasian, female, and at 77.6 years. This is now patients that are typically about 9 years after diagnosis. 5 years when they came into the LightSight 3B and another 4 years subsequent to this study. And almost all of them, 88 or 89%, were on ARID supplements. So the 36 subjects that were randomized, 38 eyes from the original PBM group, 15 from the sham, and then the non-study eyes. Only 1 patient in each of the 2 original groups withdrew, or 2 subjects withdrew after 14 months. This is the original set of data that showed after 1 month we're starting to see an improvement in BCVA. By 5 months after the second round, it's continuing up to about a line, and about 6 letters after month 9 in the 3rd round of treatment. You can see that maintained itself out for 2 years, where there was a little benefit in the sham, but again, they continued to progress and separate between the 2, and this study was very significant and led to the FDA approval. Now, if you look at the new study, we looked at those patients, and there could be some bias because of the different patients. You could assume that patients that did really good may want to continue, or patients that did really bad and were desperate wanted to get in the study. What you see here from the original pivotal trial is a similar cohort that started the LightSight 3B study. They had about 5-letter gain. Now, with 20 months, you can see they started to lose vision. They lost a total of 2.2 letters before they came into the LightSight 3B study. And upon initiating treatment again, they popped up above 5 letters or a line of benefit and maintained that out for the 14 months. If we look at both groups that were either originally the sham or the PBM, you can see the sham group, also that cohort is very representative of what we saw in the total trial as well. However, these patients continued to show vision loss over the 20-month intermission or washout period, and you can see they lost 5.7 letters, and when they were treated, we did not see a benefit, but we did stabilize, and there wasn't any further reduction over the course of the next year. So I think there's a couple interesting things here, is that one, in the PBM group, they did not wash out all the way to baseline. There was still a residual benefit in BCVE even after 20 months of washout, and when they were treated, we got them back up to above a line. The patients that did not get PBM treatment that were sham showed a further progression in that 20-month washout period, and they did not respond as well. You can see from the standard error bars there were some patients in there that did respond and some that were fairly worse off over the course of the period. This is just a delta between the trial intermission period. You can see that we have about a little under a 4-letter gain in the PBM, originally PBM treated group, and then continued on into the LightSight 3B study with a little over 4-letter loss, or a delta of about 8 letters. You can see the progression to geographic atrophy was higher in those sham patients than in the PBM. The original study and now at this study, we saw 26.3% incident of PBM treatments that went to GA, with over 60% or around 60% in the sham group. And in fact, in the PBM group, it was about 50-50 central and non-central, much higher as central in the sham group than versus non-central. Really no side effects, it was very clean. We did see in the course of the next 13 months, 3 more patients progressed in neovascular, 1 from each of the original groups, 1 from the non-study eye, 1 from the sham, and 1 from the PBM. So finally, what we can say is that the LightSight 3 PBM treated eyes maintain a BCVA benefit over the 20-month washout period compared to the vision loss in the sham PBM. And finally, the benefit gains can be repeated when they came back into the treatment and maintained out to 54 months. And lastly, I'd just like to leave with this. On July 7th, we announced that Alcon is going to acquire LumiThera, and we're very happy to see that happen, to allow this to commercialize more globally. So with that, I'm going to stop and thank you all very much.